I'm very fortunate to have met Dr. Klaus Weimer over 15 years ago, and I'd like to introduce him as one of our newest members to our World Egg and Sperm Bank team, and take it away with talking to Dr. Weimer.
Thanks so much, Diana, for the amazing introduction. And yes, I've known Diana now for many, many years. Thanks for reminding me. It's been that long. I appreciate it. But what's really been impressive for me was, when I met Diana years ago, was her amazing approach to this and maintaining the highest level of integrity in all of this process. A little bit about myself. I have a PhD in reproductive physiology, and I've been involved in human IVF since about 1986, 87. So I've got to watch a lot of the changes. My background is in animal science. Like a lot of people of my age and generation, those of us that switched over to human IVF really have our foundations from working in the agricultural scene because, and it continues today, the applications of a lot of the things that we do in IVF are routinely applied and often first developed with large animals like, say, cattle and horses. I grew up on a large cattle ranch in northern Mexico, and have been involved really in assisted reproduction my entire life. It was during my PhD that I made a discovery about embryo cultures that really changed the course of my life. And I've been blessed to get to meet wonderful people like Diane and many others. And so it's just been a great journey. I feel like I've been around during the renaissances of IVF. We've gone through ups and downs of it. And, when I first got involved, we barely cultured embryos to 2 days in culture because we did not have the support systems to get these embryos to go all the way to day 5, day 6 now. And now we can grow embryos all the way to the blastocyst stage, which is the stage that the embryos are right before they implant. We've gone from growing embryos in desiccators. Basically, it looks like a fancy pickle jar that you put in the incubator filled with gas, to now we're using time-lapse incubators that have cameras attached to them, that have servers where the data now goes into the cloud, and all of the characteristics of how the embryo are dividing are analyzed by large data sets, algorithms, and AI is now applied to that. So it's been a wonderful journey to see IVF come from a very small, kind of mom and pop to where we are today.
What brought you to the World Egg and Sperm Bank at this stage in your life?
Really, for me, it's because we've known each other for a long time. And, when we started talking about, just when we kind of resurrected a lot of our conversations, a lot of what we just had so much in common. And I'm at the point in life where, I really wanted to try to work with like-minded people who wanted really to advance, the field, to kind of nudge the industry on. And since I am involved heavily in AI now, and feel that that's really where, we're going, where now we're applying artificial intelligence, that's really kind of what started the basis, renewed our relationship again, was that.
How do you see AI affecting the future of fertility?
Well, specifically for egg banks in general, it was the follicular stimulation. In other words, the patients, whether it's an egg donor or an IVF patient, they have to take shots and medications in order to get their eggs to grow. And when you apply this to a specific egg bank, what we don't really know, and it was a great unknown, was like, why do certain donors do better than others? What can we learn from that? And because when you look at an oocyte, an egg, an unfertilized egg before the sperm has entered it, the egg is very plain looking. It's very hard to discern the quality of the egg. And so, in other words, it's very hard to study what the effects of that donor are on the resulting eggs. And we know as an industry that often patients don't understand why certain donors do better than others. And we in the industry, when we look into the mirror, we often can't answer those questions. So now with the application of artificial intelligence, we're able now to really look in levels that we've never been able to before, to look at the effects of these external medications on the resulting egg quality. And then that information then is also used to see how well these eggs do when they freeze and how well they survive the thawing process. And then also we can use this information, to be more transparent to the patient in terms of telling them, like, this is what the probability is of you getting, X number of blastocysts. In other words, that's the embryo that at the stage that we want to transfer it. So working with you has really been a blessing, because what it means now is that instead of everything kind of existing within a black box, we can create, very clear objectives. Because what AI does is when you put the egg into the incubator, what happens is there's a little camera on the bottom, and what it does is it focuses through the egg, and it takes millions of little slices of this egg, and then it goes into the cloud. And so all of these, pixelated images are then analyzed in ways that the human eye simply can't. And then what happens is that data that's collected from those resulting eggs is then compared to eggs that have made blastocysts or made babies and all that. So you can now correlate the imagery that you've collected through this microscope with outcomes. And that's just something that we've never really been able to do before. And what we're going to do at the egg bank now is really apply AI in a routine basis so that we can create the highest quality of eggs, how to individualize the follicular stimulation process, for donors and things like that. And really what it does is it creates a lot more transparency across the whole area. Instead of telling a patient, we don't really know why you didn't do very well, we'll kind of be able to manage those expectations up front. And then internally, it allows us to apply much more rigid quality control aspects, and it objectifies it. It can be used in a wide range of ways.
Yeah, I always admire the way you talk about it, reducing variability and human bias. So it does create more transparency and objective outcomes. So it's great. What is it that you wish that people entering this part of their fertility journey knew about egg and sperm donation that they don't know today, or that they might misunderstand?
Um, my eyes were not really opened about the world of third party reproduction. And when I say third party, it's that, these are couples that are having to rely on either eggs or sperm that they don't have for whatever reason. They're either, they're too old. In other words, unfortunately, menopause may have come and gone, or it's often people starting their own families. From the guy's perspective, there's, we often have gentlemen who can't produce sperm that are capable, so they have to go outside. And so I kind of thought it was very willy-nilly, like, you just follow a certain sets of protocols. But what I've learned through all this, particularly from the oocyte perspective, is that a lot of things have started to collide in the world, and that is that we've got the corporatization of IVF now has occurred. And so you're seeing a lot of what were small, successful clinics being put together into large networks. And these networks often, have international arms to them. And so what I've learned in my travels are that not all egg donation processes go through the same screening. In other words, how a donor that's in Eastern Europe is screened is not necessarily the same as how a donor in your facility is screened. And then couple that with the profit margins that the corporations have started to realize with this is kind of led us to where, we don't have the standardization that we really wish we could have. And there's a lot of factors other than, creating the highest quality egg for the patients now that are kind of driving, this area of medicine. And so that's probably the biggest thing that I've seen is I kind of thought that everybody across the world did this the same, because if you think about it, you're taking eggs from a young lady and she needs to understand that, she's got to be treated well and all of this, and she's got to be treated with respect. What's more important, what's more individual than that? I mean, there's nothing more on an individual basis than that. And so in my mind, I thought everybody kind of would follow these same rules. But what I'm learning is that that's not necessarily the case, that often egg donors are they're just not treated the same, and I think that's probably been my biggest eye-opening from my world travels over the last few years.
Yes, and I'm grateful that you said that. I think that the AI will actually help us create that consistency and the standardization that you're looking for and that we've always abided by. So we're really honored to have you guide us and join our team.
I'm really excited to be on the team, and the honor really is extended both ways because, for once, and I don't know how much the general population knows this, but when a patient starts an IVF cycle, what we try to do is get those follicles to grow over about a 10 to 12 day period. Because what happens is that the eggs, they need a certain amount of time to mature, but they also need a certain amount of time to assimilate all of the necessary factors that they need. And so by using AI, what that's really going to let us do is objectively look at, like, if we start the patient on a certain dosage of medication and how we handle those dosages throughout the treatment, what's the subsequent effect on egg quality on that? And so that's one issue. The other issue is certain donors, for example, in our industry, they make virtually 100% of their embryos are utilized. And yet there's other donors that seem to fit the same characteristic, both, from an age perspective, but all of the diagnostic testing that's done. And yet those donors don't do very well. And we don't know why. And so I kind of alluded to this earlier, is that we have this black box that we deal with. So I think for our industry as a whole, and I applaud you for being the first to do this, that often egg banks, will freeze eggs from patients and they don't really know how well they're going to do until they actually thaw the eggs. So it's kind of the experiments, the patient's the experiment on the first go. Whereas in our case, because we're going to have an objective scoring of the egg, we're going to know, and we also get a prediction on what embryos or how many of these eggs are actually going to become usable blastocysts. Then we know up front internally, do we like this donor? Yes or no? Do we want to use this donor? If this is a donor that we really like a lot, how do we make adjustments to the medication? And then as a result, we can also be very transparent with the patient, saying, we froze these eggs. This is what their their probabilities are. And again, it just creates a level of managing expectations, both internally and externally. And I just think that's the most important thing, because, for those of us that work in IVF clinics, we dread the phone call to a patient saying, you know what? We don't really have anything right now, or your eggs didn't survive the thaw process. And the patient's going, well, why? I mean, oh my God, how can this happen? And many times the answer is, I don't really know. There's just, that's the black box of biology. And we're trying to create more windows of transparency with this.
Well, we certainly appreciate it as a parent of donor children. Anything that we can do to advance the science to make it easier for people coming and trying this egg donation and sperm donation, which has really high probabilities these days, I'm grateful for.
Yeah,
Thank
and
you.
I really no, I'm really glad to be a part of it. It's an honor and a pleasure. I did want to say too that the world, the face of third party reproduction is changing. Everything used to be very anonymous now, and now with the transparency of parents wanting to know who their donors are, both the male and the female. Again, accountability on all parties becomes that much more of paramount importance, because 20 years ago, when we were doing all this, Diane, every egg donor, every sperm donor was completely anonymous. The thought of even getting to know who your donor was like, there was no way in hell that was ever going to happen. And now that families choose to like be able to say, hey, your little brother is from a frozen egg, and guess what? We have a relationship with the donor, or we know who the donor is. Then that bridge of accountability becomes even that much more important for us all, both how the donor was managed and taken care of, the respect that was shown to her, but then also it puts a lot of pressure on us because now we've personalized this that much more. So being able to incorporate technology to pull all this together to kind of create the transparency that's kind of the theme now of our discussions really becomes that much more important, I believe.
Well, I think that's a perfect conclusion to our discussion.
Thank you so much.